So, today we're going to dive into the story of how one of India's biggest states, Maharashtra, fought two completely different waves of COVID-19. And the data tells this incredible and honestly pretty cautionary story. Let's get right into it. I mean, to really get the scale of this, we're talking about a state with over 11% of India's entire population. So, when a crisis hits there, the impact is just massive. The first wave, well, that was a huge shock to the system. But what came next, that was something else entirely. And that's the big question, isn't it? It's so easy to think a second wave is just more of the same. But the data we have from Maharashtra shows two totally separate events. They had different characteristics, they spread in different ways, and they had a very different human cost. So what changed? All right, so let's rewind the clock a bit. Let's start at the beginning with the first wave. This thing kicked off in March 2020, and it lasted for almost a whole year. This was really the world's first major introduction to the virus at this kind of scale. It all started with that first case popping up in the city of Pune. From there, the virus just spread, building and building until it hit this staggering peak. We're talking nearly 25,000 cases in a single day that September. But then, over the next few months, with public health measures and people changing their behavior, the numbers came way, way down. There was this feeling of, cautious optimism. Now, to really understand how fast a virus is moving, scientists use this key number called the R0, or R0. Just think of it like the virus's raw horsepower. So in a population where absolutely no one has immunity, an R0 of, say, 3 means one sick person is going to infect, on average, 3 other people. And this is where you can really see the initial power of the virus in Maharashtra. Before any rules were put in place, the R0 was a huge 5.2. That is just wildly contagious. But then, look what happens with the nationwide lockdown. It cut that number almost in half, down to 2.9. I mean, that's proof right there. Those big public health measures, they really worked. They slowed the spread down big time. But just when it seemed like things were finally getting under control, when the state was kind of breathing this collective sigh of relief, everything changed. The second wave hit, and wow, it hit with a vengeance. Just look at that number. Over 68,000 cases in one day. That's nearly 3 times the peak of the entire first wave. This wasn't just another wave. It was an absolute tsunami. It just completely swamped healthcare systems, communities. The speed and the scale were on a whole different planet. Okay, so for the second wave, we need a slightly different tool. We can't really use R0 anymore. And why is that? Because the population isn't starting from zero, right? A lot of people had already been infected, some were starting to get vaccinated. So we use what's called the effective reproduction number, or RE, which takes all that existing immunity into account. Okay, get ready for this because this number is, honestly, it's terrifying. At its absolute peak, the second wave's effective R number hit 5.2. Let that sink in. Even with some immunity in the population, the virus was spreading just as explosively as it did at the very, very beginning of the pandemic. That should have been a massive flashing red light for everyone. So you've got these two very different waves, right? One was this long, slow burn, and the other was just this sudden explosion. To really get it, we've got to put the data side by side. And this is where the story gets really interesting. The attack rate, basically the percentage of the population that got infected, it nearly doubled in the second wave. It was way more widespread. But here's the twist. The case fatality ratio was actually much, much lower. So way more people were getting sick, but a smaller percentage of them were dying from it. So what does that mean? Well, it points to a whole bunch of different things happening at once. Maybe new variants, maybe better treatments, or even a change in who was getting sick. And this quote from the researchers who studied this really just hits the nail on the head. It tells you the single biggest difference between the two waves. The first one, it was mostly a big city problem. The second one, that was a whole other story. And you can see it right here in the data. During that first wave, there was a really strong statistical link, a correlation. See that R value of 0.70? That statisticians speak for a very, very strong connection. Basically, the more urban a place was, the worse it got hit. Simple as that. But then you look at the second wave, and that link just falls apart. The correlation drops way down to 0.44.
And what that number is really telling us is that the virus had escaped the cities. It was now spreading like wildfire through rural communities, places that often had way less access to hospitals and doctors. Which, of course, brings us to the million-dollar question, why? What on earth happened to create a second wave that was so different and so much worse?
Well, the study points to what you could call a perfect storm. 3 big things happening all at once. First, after that long first wave, restrictions were eased up. Shops, restaurants, they all reopened. Second, you had what the researchers call complacency. People were just tired, and they started relaxing on things like wearing masks and social distancing. And third, the real biological game changer, new, much more contagious variants, especially the Delta variant, started showing up.
Okay, so after digging through all that data, what's the big takeaway? I mean, looking back at this story isn't just about history, right? It's about trying to find a roadmap for how to handle these kinds of things in the future. And the researchers lay out a pretty clear 3-pronged strategy. First up, vaccination is still absolutely key, especially for people who are most at risk. Second, we just can't let our guard down. Things like masks and distancing are still incredibly powerful tools. And third, and this is huge, we have to keep a constant watch on the virus itself, tracking new genetic variants before they have a chance to explode. And that leaves us with one final and really important question. What happened in Maharashtra was a huge warning sign about how fast things can turn because of a virus evolving and because of our own behavior. The virus is still out there and it's still changing. So the real test is, did we actually learn the lessons from this tale of 2 waves?